So today we will continue now with the chemotherapy of certain particular conditions. In yesterday's class, we had seen about how sulfonamides and nitrofuran compounds are used. So since these compounds are used in treatment of urinary tract infection, we will take up that topic next. So when we say urinary tract infection, it is any infection caused by certain organisms which affects the different parts of the urinary system. So although UTI is short form for urinary tract infection. So UTI is quite common in both men and women, but it is uh, more commonly found in females. So when you say UTI, there are some people who have sudden episodes of UTI, so it is called acute infection. And in some people, chronically, the bacteria will be there and they will be causing problems. So that is chronic UTI. And most often, these urinary tract infections are caused by organisms which are gram negative in nature. When you study the organisms, then the most common organisms which cause UTI are E. coli, and in some cases, it may also be caused by uh, microbes like Aerobacter or Pseudomonas aeruginosa or Proteus mirabilis or Klebsiella, Streptococci and Staphylococci. So when we want to study about the drugs which are used to treat this infection, then we can classify them into different categories. The first category are the synthetic drugs and the second category are the antibiotics. So among synthetic drugs, the ones we saw yesterday, sulfonamides, nitrofurantoin, cotrimoxazole, methenamine mandolate, and nalidixic acid can be used. Then among the antibiotics, a combination of different categories of antibiotics can be used. But as we said, because these organisms are mostly gram negative, then you have to make sure that we are using the antibiotics which are effective against gram negative organisms. So ampicillin, cephalothin, streptomycin, kanamycin, gentamicin, then the fluoroquinolone molecules like ciprofloxacin, these can be used, cycloserine and polymyxin B. The sulfonamides, we have already seen about them. So commonly the compound like sulfadimidine, which is a short-acting sulfonamide, is useful if there is acute urinary tract infection. In people who have chronic, then you need to use long-acting sulfonamides. Nitrofurantoin also is another compound. It is having mainly bacteriostatic effect. It is not bactericidal in nature. So if you give the other drugs and the organisms are not getting killed, then we can make use of nitrofurantoin. So it is effective in those infections which are resistant to other drugs. And if there is an alkaline medium, then the antibacterial activity of this drug can reduce. So sometimes it is common to give nitrofurantoin along with a urinary acidifier so that the acidic pH of the urine will be maintained and then this drug's activity will be good. Cotrimoxazole is another compound we have already seen. It is actually a combination of sulfonamide such as sulfamethoxazole with trimethoprim. Now this is having bactericidal effect, but because it is having teratogenic property, it should not be used in pregnant women. Methenamine mandolate can be used. Nalidixic acid also can be used. Now these are good drugs and they are generally reserved for use whenever the other set of drugs like if nitrofurantoin or cotrimoxazole or the sulfonamides, if those are not useful, if the patient does not respond to those drugs, then we make use of nalidixic acid. Then coming to the antibiotics, we can use ampicillin, which is effective against gram positive as well as gram negative bacteria. It can be given orally or parenterally. Cephalothin is belonging to the category of cephalosporin antibiotics, and it is very much useful if the organism which causes the UTI is Klebsiella. Then streptomycin, kanamycin, and gentamicin are very good, no doubt, but they can cause some toxicity to the ear ototoxicity can be there, or nephrotoxicity, that is some toxic effect on the kidneys. Then fluoroquinolones like norfloxacin and ciprofloxacin can be used. And nowadays they have become very common. And anytime anybody has a urinary tract infection, then these molecules only are generally preferred. Cycloserine and polymyxin B also can be used. Then we come to the next set of disorders called as sexually transmitted disease, or they are also called as venereal diseases, or in brief, that sexually transmitted disease is abbreviated as STD, right? So whenever there is any disease which is going to be transmitted mainly by the medium of sexual intercourse, then those diseases are called as STDs. So they include syphilis, gonorrhea, non-gonococcal urethritis, cancroid, lymphogranuloma venereum, and granuloma inguinale. So these all disorders can be treated by using certain compounds. So syphilis is commonly caused by a spirochete organism called Treponema pallidum, and this syphilis is a very long drawn disease. It will last for a very long time, almost up to 4 years. So it is important that it should be treated properly, because if it is not treated properly, that person who has syphilis will spread it to other people when they have sexual contact with them. And also, at the end, if it is not treated, it can cause a very painful condition and person may die also. So the treatment for syphilis is, firstly, they will give procaine penicillin, which is one of the penicillin molecules, for 10 days every day. Then they give another compound called PAM, and then they give benzathine penicillin. So this is the treatment which is followed for the first few days, which is early syphilis treatment. Then beyond the 4 years after that disease has been acquired, if you diagnose it, if it is late syphilis, then at that time you can give penicillin, but you have to give it for longer duration. You have to give it for 20 days. Now, some other drugs like tetracycline and erythromycin can be used, but they are not as effective as penicillin. However, we want to give penicillin because it is the best drug, but sometimes people have an allergic reaction to penicillin, or they are hypersensitive to penicillin. So in such cases, we must make use of tetracyclines and erythromycin. Gonorrhea is another of the STDs. It is caused by gonococci. So whenever there is an uncomplicated case of gonorrhea, the treatment for that will be penicillin in combination with probenecid, ampicillin or amoxicillin in combination with probenecid, or procaine penicillin followed by crystalline penicillin can be given. But if somebody is having a very complicated case of gonorrhea, then we have to give them procaine penicillin and tetracycline in combination. Then the condition called as non-gonococcal urethritis. It is due, generally what happens is the organism called Chlamydia trachomatis will infect the urinary tract, and because of that, this form of disease will be produced. So the treatment for that is tetracycline, and um, tetracycline has to be given for 2 weeks, and after that they will give doxycycline for 2 weeks. Cancroid is another of the STDs, and the specialty is that this cancroid cannot be treated by penicillin. It is insensitive to penicillin. So it has to be treated by providing erythromycin, azithromycin, and ciprofloxacin one after the other. Lymphogranuloma venereum is also caused by a chlamydia organism, and for that the treatment is tetracycline. Then granuloma inguinale, here we give tetracycline combined with ampicillin. So as you can see in this presentation, these are all to be treated by giving medicines for 2 weeks, 3 weeks, 10 weeks, 10 days, 11 weeks, like this. So it is a long drawn kind of treatment, and you must make sure that the patient has taken that medicine throughout that period for it to be effective. If not, the disease will not go away, it will come back. Then we come to the treatment of AIDS. As you know, the full form of AIDS is acquired immunodeficiency syndrome. Now, this is caused because of the virus, which is the HIV virus, human immunodeficiency virus. Now, this disease is also transmitted by sexual intercourse. That is why it has come in this category of STDs. But there are certain other methods also. If any exchange of body fluids is taking place, like suppose there are drug users, narcotic drug addicts, right? So they will be injecting the drugs into their body. So when those needles are contaminated and needle syringes are contaminated by one person's blood and the other person uses it, that way also AIDS can spread. Or during the process of blood transfusion, or from the mother to the fetus also this virus can spread. And we know that the AIDS virus is very dangerous. It will affect all the immune system of the body, and it will affect the brain cells also. And because the immune system is affected, then there are very great chances that the person will develop other infections because their immune system is not able to resist those conditions. It can also lead to cancer. And we know that there is no cure for AIDS. So somebody who has developed full-blown disease of AIDS is going to die at some point of time. But there are certain drugs which can help to give relief from the symptoms, and they can slow down the progression of the disease. So compounds like AZT, thymidine. This can be used. It is a synthetic analog of thymidine, and its mechanism of action is that it will inhibit the transcriptase enzyme in the virus. So because of that, viral transcription process cannot take place and the viruses will stop growing. Okay, it can be given orally as well as intravenously. It's one of the main drugs which is used. Then didanosine can be used. This will, what it will do is, it has a structure similar to deoxyadenosine. So because of that, it will get added into the viral chain and it will inhibit the reverse transcriptase enzyme, which is required for the synthesis of nucleic acid in the virus. And people who have advanced HIV infection, we use didanosine to treat them. Then efavirenz is another drug which is used in AIDS. It also inhibits reverse transcriptase enzyme and it can cross the blood-brain barrier. So people in whom the virus has attacked the brain, they can use this drug. The other drugs don't have the ability to cross the blood-brain barrier, but this drug has. Also, the resistance to the drug is less with efavirenz. So this is used in such conditions. Then we have sakinavir, which is a peptide derivative. This will inhibit an enzyme called as HIV protease enzyme, and it is common to use this sakinavir in combination with azithromycin. So this is about the drugs which are used to treat urinary tract infection and drugs used in treatment of sexually transmitted diseases. Now we will go to the other part. So we will take up about the quinolones. We come back now to the antibiotics that we are talking about. I only took that part about urinary tract infection because it came, the drugs which we saw last time are used, right? So now we have come back to the chapter which talks about antibiotics. So quinolones are one important category of antibiotics. One of the main compounds there, the oldest drugs, is nalidixic acid. Now this is effective especially against E. coli and other gram-negative bacteria. Okay, and it has no action absolutely. It is totally ineffective against gram-positive bacteria. Now, how does this drug act? It will inhibit the replication of DNA. You know that DNA replication has to take place for cell division and for further growth and multiplication of the organism. So if the DNA replication is inhibited, then it will have a bactericidal action. Okay. So this drug is absorbed, but it gets excreted also very fast. So you cannot use it for systemic infections, but as we said, it is excreted very fast and the large concentration is available in the urine. So we use this nalidixic acid also as a drug to treat urinary tract infection. We have already seen in that category of drug, right? It has some side effects like nausea, vomiting, diarrhea. In some people, it can cause some allergic reactions like pruritus. Pruritus means itching. Urticaria means the person will have skin itching, rash, and other conditions. Then it can have some CNS effects like headache, drowsiness, and malaise. It is given in the form of tablets or in syrups, and it is used to treat urinary tract infections and bacillary dysentery. Then there is the next set of compounds which are called as fluoroquinolones. So as the name indicates, they will have fluorine in the structure along with the quinolone ring system. So these compounds are chemically related to nalidixic acid. Nalidixic acid is a quinolone molecule, and fluoroquinolones are the ones which have fluorine extra. Now, these are better than the quinolone drugs because the spectrum of action is broad. That means they will act on a wider range of organisms. Also, the side effects are less and they are able to penetrate the tissues in a better way. So, fluoroquinolones are classified into two categories. The first generation agents like norfloxacin, ciprofloxacin, pifloxacin, and ofloxacin are used. And then we have the newer molecules which are the second generation agents like levofloxacin, lomefloxacin, sparfloxacin, gatifloxacin, and moxifloxacin. These are more commonly used nowadays. The mechanism of action of the fluoroquinolone molecules is that they are bactericidal and they act by inhibiting DNA gyrase enzyme. So because of this, the replication of the bacterial DNA is prevented. They are very effective against organisms which such as Enterobacteriaceae, Haemophilus influenzae, Salmonella, Shigella, H. pylori, and Pseudomonas. Um, the adverse reactions are less compared to the previous category of drugs and they are tolerated well. But some people will suffer from nausea, vomiting, and diarrhea. And to deal with that, you can prescribe, doctors will prescribe antacids along with these antibiotics. In very few cases, there can be some CNS side effects or some allergic reactions. So these compounds are used in treatment of urinary tract infections, respiratory tract infections, then gastrointestinal infection like gastroenteritis and diarrhea, or external otitis, that is infection of the ear, of the external ear, then osteomyelitis, which is a condition which affects the bones. There is infection of the bones by some gram-negative organisms. And these drugs are the first choice to treat typhoid fever. When somebody develops typhoid, then these fluoroquinolones are used. If people have tuberculosis which is not responding to the other drugs, we have already seen anti-tubercular drugs. So if those drugs like rifampicin and all are not effective, then they make use of fluoroquinolone molecules. And for eye infections also, we can use fluoroquinolone molecules. Then we come to the category of penicillin and other antibiotics, which are mainly used against gram-positive organisms. So we have all studied about how this penicillin was discovered by Alexander Fleming. Now, for a long time, the penicillins were the most important antibiotics. And now only recently, when there are newer antibiotics, the usage of penicillins has slightly reduced. Okay, so these are obtained from fungus called Penicillium notatum and Penicillium chrysogenum. So in the penicillin structure, there is mainly one nucleus called as the 6-amino penicillinic acid nucleus, and to that side chains will be attached. So based on what is the side chain, we can have different kinds of penicillin molecules. So the mechanism of action of penicillin, this is important. So it is a bactericidal drug, and what it does is it will prevent the synthesis and the linkage of peptidoglycan in the cell wall of the bacteria. Now, the bacteria have cell walls and they need the substance called peptidoglycan to be synthesized and properly formed. Then only that cell wall will be intact and the bacteria will be able to grow further. But if there is damage to that cell wall, by breaking the peptidoglycan or by not allowing the peptidoglycan to be synthesized correctly, then that will destroy the bacteria. So this is what the penicillin does. So penicillin G, which is also called as benzyl penicillin, is the most commonly used penicillin, and that is having narrow spectrum of activity. It is mainly used against gram-positive organisms. So if we classify the penicillins, we can have what are called as natural penicillins, which are directly obtained from the fungus, and we have semi-synthetic penicillins, where part of the synthesis is from the fungus, and then in the laboratory we are synthesizing the penicillins. So the natural penicillins, there are two categories. One is what is called as the regular penicillin or penicillin G, and then we have what are called as repository forms of penicillin, such as procaine penicillin and benzathine penicillin. A repository form means it will be present as a large dose, and slowly the drug release will be taking place. In the semi-synthetic penicillins, we have further four categories. We have some penicillins which are acid resistant, like penicillin B. Then we have some which are penicillinase resistant. So what will happen is, these organisms, once you start giving the penicillin, the bacteria are very smart. They will start producing the enzyme called penicillinase, which will destroy that antibiotic which we are giving. So to prevent that, they have come up with certain molecules which are resistant to that penicillinase enzyme. So compounds like methicillin, oxacillin, cloxacillin, and nafcillin. These are all penicillinase resistant penicillins. Then we have amino penicillins, where extra amino group will be present, like ampicillin, vacampicillin, talampicillin, and amoxicillin. So you may have heard these names, they are very common, so they are used often. And then if we want the penicillin to act against pseudomonas infections, they have developed anti-pseudomonal penicillins. So there we have two categories, carboxypenicillins such as carbanicillin and ticarcillin, and uridopenicillin such as azlocillin, meslocillin, and piperacillin. So the benzyl penicillin can be given in the form of tablet or injection. The repository preparation, as I said, it is a slow release form. So they are insoluble compounds, because of which they will release the drug very slowly, and the effect will be prolonged. So procaine benzyl penicillin, fortified benzyl penicillin, benzathine penicillin, and combining with of penicillin with probenecid. All these will help to increase the duration of action of the penicillin. So all of these can be used. Now, although penicillin is very effective, it is used in treatment of different disorders like streptococcal, pneumococcal, and meningococcal infections, treatment of venereal diseases like gonorrhea and syphilis, treatment of diphtheria, tetanus, gas gangrene we can use, actinomycosis and anthrax are some conditions. Then to prevent rheumatic fever and streptococcal infections also, we can use penicillins. So they have a large set of uses, but there are unfortunately many adverse reactions also with the penicillin. Like some people will develop intolerance, which may show up in the form of allergic reaction or anaphylactic reaction. So that allergic reaction, how we can make out when the patient develops skin rash, or if they have disturbances in the kidney function, renal disturbances, or if they develop hemolytic anemia. Now, if somebody has a severe anaphylactic reaction, then they will suffer from cardiovascular collapse. Their cardiovascular system will stop working. They will have bronchospasm and angioedema, because of which the breathing will be stopped, and it can lead to death also. That is why generally, before somebody is given penicillin, the doctors will inject one small dose into the arm. Then they will mark that place where they have injected, and they will observe the patient for about half an hour. And if there is a reaction, if there is redness, if there is rash, if there is swelling and pain, then they will not give penicillin to that patient, because it means that they are having an allergy for the penicillin. So instead, they will be using some other drug. Then also some people, when they are given penicillin, that infection what they are having will get cured, but they may get infected with other organisms like Klebsiella, Aerobacter, and Candida. Then Some people suffer from miscellaneous adverse effects like nausea and vomiting, or they may have inflammatory reaction if it is given intramuscularly. And in patients who are having syphilis, there is a typical adverse reaction of penicillin, which is called as the Jarvis-Herxheimer reaction. So because of these reasons, all these adverse reactions, penicillins are effective, no doubt, but the newer forms of penicillin are used rather than the old molecules of penicillin. And if it is possible to use some other antibiotic, then those antibiotics are preferred. So we'll stop here for now, and the semi-synthetic penicillins we will go to in the next class.